When somebody comes into the trauma bay, we cut all of their clothes off, we roll them front to back, we check everywhere for any type of penetrating trauma. You come across a wound like this, and you do see that it is acutely bleeding. As you can see, there's some pretty heavy bleeding going on. The very first thing you're going to do is direct pressure. If you see here, there is another wound further up, and if I push my finger all the way down in there, I can actually press on the blood vessel and also tamponade that bleeding. So that's why this prop is really good for educating people on both direct pressure to the site of bleeding, but also packing a wound. So let's go over how do you pack a wound. You're going to want, if possible, kaolin impregnated gauze. We have QuikClot here, which is my preferred method. But even if you don't have that, even if all you have is just regular standard gauze, well, you take it, and the way that I recommend doing it is having a little tool like a forceps or something like that, because as you'll be able to see here, with this wound continuing to bleed, as I pack and pack and pack into that wound, as you can see here, forceps allow you to really just grab more and more of the gauze and push it further and further into that hole. It's going to do the same thing my pinky finger was doing. It's going to put pressure on that wound, and it's going to stop that bleeding. Now that I have the bleeding better controlled, I don't want to stop there. I want to pack this thing in so tight so that it's not going to come loose. And so you keep adding more and more packing, and especially if you have the hemostatic gauze packing, you will get double the effect, because that kaolin that's impregnated in the gauze will also help seal that blood vessel. So now, as you can see, I've got pretty good control of that bleeding. So now it's time to finish out the pressure dressing. And so there's two things that you need to do in order to do that. First is you take a couple of your 4x4s, you fold them once, and you fold them again. This is going to give you a focal point of pressure directly over that packed wound. And then you want to put more gauze on top of that. And then once that pressure is all applied, now is whenever you want to wrap it with a compression wrap, preferably something like an ACE wrap or a Coban wrap.